Hi, my name is Jaclyn and I'm a nurse. I started as a registered nurse back in 1999, so a long time ago. I wanted to go into a healthcare profession and I really wasn't sure which one I wanted to do, but I thought nursing was pretty cool because it combined like a variety of things. You worked with the doctors, you worked with occupational therapy, speech therapy, and you were also like directly involved with the patient for 8 to 12 hours at a time. And so I really am a people person, and I like getting to know people, and I like connecting with them and their families and just being with them through hard times. And that's why I chose nursing. There are different ways that you can go to being a nurse. A lot of high schools have a CNA program where you can start out and become a certified nursing assistant. It's good to do that because most programs require that you do have a CNA degree before you start a nursing program. And then there are 2-year registered nurse programs, and then there are 4-year registered nurse programs. So I started with the 2-year, and I went to a small community college in New York State, and then I transferred to a large university in Washington, D.C., and I completed my bachelor's degree all the time while I was working. So that was good. I was a registered nurse by the time I was 20, and my patients would often ask me, what school I was going to because I look so young. But it was a really good thing because I made good money. I got a lot of experience. It was a 2-year degree, and I was able to further my education and my career even further. So after that, like I said, I got my bachelor's degree, and then I just kept moving forward and got my master's degree in nursing. And as a master's degree in nursing, I am a nurse practitioner. So I do diagnosis and treatment like a physician or a physician assistant would. I prescribe medications, I order tests like x-rays or CAT scans. I've worked in a variety of settings. That's the great thing about being a nurse or a nurse practitioner is you can work anywhere. You could work in like the school system as the school nurse. You could be a public health nurse where you go to people's homes. You could be a hospice nurse where you take care of people while they're very, very sick and they just want to be at peace at home with their family. You can work in the hospital, you can work at a pediatric clinic, you can work in a same-day surgery place, you can work in a radiology department. You can even work for like insurance companies and corporations because they need people that have healthcare experience. I have done a little bit of work as a nursing legal consultant, and I worked on some malpractice cases, where somebody says, hey, you harmed me, and they seek damages in a court of law for it. So I was what they call an expert witness in a pretty big malpractice case. So lots of things that you can do. I've worked in the emergency department. I've worked in urgent care, I've worked in vascular surgery, vascular radiology, I've worked in like a wellness, health and wellness for a company in Eastern North Carolina where I just worked with county employees on managing their health conditions and education and just making sure that they were getting the treatment that they needed and that they were staying current on all of their health tests that they needed. And let's see, so now, just a year ago, I opened my own business. And my business is a telemedicine business, so I opened it in September of last year, and this was before the coronavirus hit, I always say before telemedicine was cool. And so I opened LoginClinics, and it's simply just that. Instead of walking in, you log in. And so in North Carolina, you actually need a physician to what we call collaborate with you in order to open your own business. So I had to find a physician to collaborate with me. That's a little difficult, a little challenging, because sometimes they don't want to because they have to pay money to collaborate with you. But North Carolina, we think in the future we'll get rid of that rule because North Carolina is only one of 19 states that requires that you have a collaborating physician. A lot of other states require or let nurse practitioners practice what we call autonomously or by themselves. So I just got licensed in Virginia for my company, LoginClinics, and in Virginia, you do not need a collaborating physician. You simply need I think it's like over 9,000 hours of direct patient experience under a physician. So some people ask what's the difference between nurse practitioners and physician assistants, because they seem like they do the same thing, and that is very true. If you were to apply for a job, the job posting might say, looking for physician assistant or nurse practitioner, and we would do the same job. Like, we both diagnose and treat. We are both what's called mid-level providers. We both make about the same amount of money. So how much money do you make? Well, starting in North Carolina, it's different if you were to start in California or Washington, D.C., areas that have higher cost of living. They would generally pay you more. But here, I believe they start nurses or nurse practitioners out at about $40, $50 an hour. So that's pretty good. In the future, they're going to require that you have your doctorate in nursing. A lot of healthcare professionals or healthcare programs are moving toward that. So the pharmacist now is more required to have a doctorate in pharmacy. Physical therapists now are having their doctorate in physical therapy. And so this is different than a doctor in medicine or a medical doctor, but this is just more years of school than a master's degree, which is normally 6. So something to consider, that eventually it's going to be a doctorally prepared practice. But I think that that's just kind of how the way things are just going in healthcare now. So if you're considering going to become a nurse or a nurse practitioner, I would suggest that you get experience as a nursing assistant, or that you volunteer maybe in an assisted living facility, or that you volunteer in a hospital. Hospitals are always looking for youth to volunteer. They might do a variety of jobs like food service, or you might deliver papers, or you might visit, just pay social visits to the elderly and talk with them, see how they're doing. Generally, it's the workings of the hospital that you would help with. Sometimes they do assign volunteers to specific units of the hospital, so you would just have to check with your local hospital to see. But that always looks good on a resume. It always says, hey, I love people and I'm interested in helping them get better. I know I've talked about this already, but the highlights of my career would just be how versatile nursing is, how every place needs a nurse. No matter where you go, you can be assured that someone's going to say, is a nurse here? Or I need a nurse. Nursing is actually a profession that's highly revered. People look up to nurses. In Gallup polls, they ask, what's the most honored profession? And time after time, nurses kind of take that, because we're generally known as very compassionate, loving, caring healthcare professionals that are there with the patients and with their families every step of the way through their healthcare process. So it's a great career. You can do nursing, but you can also do something you love. So if you love sports medicine, you might be a nurse in sports medicine. Or if you love the brain and neurology, you might be a nurse on neurosurgery. And there's various different schedules, like you could work 8-hour days, you could just work weekends, you could work 12-hour days. There's always a need for a nurse at all times of the day or night, and weekends and holidays. So that would be something to consider as well, if it's very important to you that you have every single holiday off, and that you don't work Christmas or Thanksgiving or New Year's or Easter or anything. That's going to be a problem in the healthcare industry. People get sick all the time, so hospitals and clinics need to staff all the time, even on holidays. I think some of the challenges that I've faced on my job would be just growing up in healthcare. So I was a nurse when I was really young. I was 20 or 21 when I started, and it was hard just working in an adult world with people of various ages and temperaments. I was working with people in their 20s, 30s, 40s, 50s, 60s, and I was really young, and I was scared, and I wanted to make sure I didn't do the wrong thing, or I didn't give the wrong medicine, or it was very, very difficult at times. But what I ended up doing was finding mentors, and oftentimes your first job will assign you a mentor as a new nurse, and they will pair you up with that person, and you will meet regularly. And you know, if you have an issue, you would talk to them, call them, email them, whatever. And they always pick out wonderful people that just love young professionals and want to help them. So I have found that my professors were a great resource, and the people that they paired up with me to encourage me and motivate me and keep me happy and smiling, because it was a difficult transition, but I'm glad I did it. There are always going to be people who are miserable or who are unhappy with their lives, and you can tell because they're not generally nice to other people. Just because somebody goes into healthcare doesn't mean that they're going to be nice all the time. We all have bad days, right? And some people are dealing with their own emotional problems that they have at home. And so that was one of the toughest challenges for me, was just being confident in myself and also dealing with other people who I expected to behave like adults because they were older than me, but they didn't. So that was hard. But again, you want to find that person who you can talk to, who you can confide in, and who can support you. So I am not wearing what I would typically wear to work. I am wearing my Nurses Inspire Nurses t-shirt. And I follow Nurses Inspire Nurses on Instagram. I love the woman that runs it. She's very inspirational, motivational, and positive, and that's my mantra, and that's who I choose to surround myself with. When I go to work, when I'm doing telemedicine, I look professional. I wear a lab coat and I wear, you know, a nice outfit. And when I go to work at the urgent care, I wear scrubs and a lab coat. So pretty basic kind of stuff that you see on like Grey's Anatomy. If you were to be a school nurse, or if you were to be a nurse at a correctional facility, a prison, a hospital, there would potentially be different things that you would wear. My kids like to make fun of me, and they say, "You go to work in your pajamas," and I say, "Yes, I do." So if you like to go to work in your pajamas and you don't mind working on some weekends and holidays, nursing might be for you.